Well, Trauma Awareness Month is in May of each year. This was actually started in 1988 when President Reagan and Congress designated that specific month for us to really think about what is trauma, and more importantly, so we could focus on injury prevention initiatives. And I can tell you that we focus on that here at UMC every month of the year. We talk about safe driving, drunk driving reduction in falls. That is one of our major things that we see with injuries is elderly patients that are falling down. And these people that are older, they have all types of medical problems, so we have to deal with that. So we really do focus on that, as well as things such as safety around swimming pools, ATV crash reduction. That is something that our trauma program here at University Medical Center really does a great job. To be a level 1 trauma center is the highest designation of a trauma program, and you have to meet so many requirements to do that. Not just all the clinical requirements, but also academic scholarly requirements, meaning research, giving presentations at scientific meetings, doing publications in peer-reviewed journals. We are the only level 1 trauma center in a 270-mile radius. The next nearest trauma center is actually in New Mexico, 270 miles away. There are 18 level 1 trauma centers in the state of Texas, and we are the only one in this region. We are a growing trauma center. We are actually celebrating our 20th anniversary as a level 1 trauma center this year. For El Paso in the region, what we do see a lot is car crashes, motorcycle crashes, falls, especially in the elderly population, and those are patients that have other issues that they have to deal with. A lot of times they have syncopal or fainting events that result in their injury. We also, unfortunately, due to the migrant crisis, are seeing so many patients coming to us that have injuries from the border wall. I don't think that's even recognized. We probably see 1 to 3 patients per day, and these patients have severe injuries. They usually have injuries to their lower extremities, which mean fractures, and spine injuries to their back. Just 10 minutes ago, I got called to the ER for a patient that fell with injuries to the leg due to the border wall. So we are seeing that, and I don't think the people really realize how much that's impacting our trauma program. For the horizon for the UMC's trauma program, which is a combined trauma program with El Paso Children's Hospital and UMC and even Texas Tech, as well as our private practice doctors that provide some specialty care to us, we're seeing growth. Not just growth in the volume of trauma patients or more severe injured patients, we are seeing specialty care that we provide that is unique to the region. We have 2 microvascular replantation surgeons now. So if you have an injured finger where you have your finger or even your hand cut off or even a shoulder, we can replant that. And that's really complex care. We have a vascular surgeon, a board-certified vascular surgeon that just joined us earlier this month. And we have a second vascular surgeon joining us where they're doing cutting-edge endovascular repair of vessels, big vessels and small vessels. So that is unique to the region. We have a physiatrist, which is really a rehabilitation doctor that we are embedding in our trauma program. She will be joining us in mid-May to help us deal with patients with severe traumatic brain injury and spinal cord injury. And I'm really excited because that is something sort of unique to trauma programs, to have that doctor, that specialist embedded with us. We're providing more and more pediatric specialty care, and it's really an exciting time. We are doing something that is unique in this area. We have whole blood, which is not the old type of blood where you give packed red blood cells or plasma or platelets. We give all this combined. And I actually had a patient last night that we gave 2 units of whole blood to. And I can tell you it makes a world of difference in our resuscitation. We're requiring less fluid, better outcomes, shorter length of stay, and that is really a neat thing that we're doing. We're also doing other stuff, something called TXA, tranexamic acid, where we give an injection to the patient when they hit the trauma bay, and then we give another 8-hour infusion of that, and that helps reduce bleeding. And the literature is very clear. It all started in the military in Afghanistan and Iraq, where they were showing better outcomes, and now that's gone to the civilian sector. One of the things that UMC has done is offered this TXA to our pre-hospital ambulance companies, where they're now giving it to the patient before they arrive, and then we continue it here. Because it's been shown that if you give this early, you get better outcomes. So the sooner you get it to the patient, the better. It's a great product, it's very safe, it's relatively cheap, and it's a good way of improving outcomes and definitely saving lives.